How's it going, everybody? We got a quick update here. It's been a breakout in Brampton. According to the Global News, a Brampton Amazon facility must close. Workers need to self-isolate amid breakout. Peel Public Health. An Amazon facility in Brampton must close. All of its workers must self-isolate for 14 days effective midnight, Saturday, amid a COVID-19 outbreak. Peel Public Health said Friday, the current public health investigations has determined that high-risk exposure to COVID-19 for everyone working at Amazon Heritage cannot be ruled out. Over the past few weeks, the rate of COVID-19 infections across the Peel has been decreasing, while the rate inside this facility has been increasing significantly. A statement from Medical Officer of Health Dr. Lawrence Lowe said Friday. All the workers at that facility, located at 850 Heritage Road, are required to self-isolate until March 27th unless they have tested positive in the last 90 days and completed their isolation period as directed by Public Health, the statement continued. The health unit said it has been working closely with Amazon to contain the outbreak, which began in October and has since been linked to more than 600 cases, with nearly half emerging in the past few weeks. The closure would also allow the company to pursue additional operational changes the health unit has recommended in order to avoid future outbreaks. There's evidence that those cases are actually spreading outside the contained cluster that have been previously identified, he said. Several of these recent cases have found involved more contagious variants of COVID-19, although those are not believed to be the key driver of this transmission. The Amazon facility is a vulnerable community and employs thousands of people, Lowe said. Immediate action must be taken to protect these essential workers and the communities where they live. The decision was difficult, but it was necessary. One, to stop the outbreak from spreading further in both the facility and the community, Lowe said. Essential workers remain the backbone of our community, and I continue to urge both employers and policymakers to provide paid sick leave to anyone impacted by COVID-19, he said. Lowe said that his public health unit has asked Amazon to provide workers with all the resources they need to self-isolate properly, including paid leave. A spokesman for Amazon Canada argued that there's little risk of catching the virus within the facility, saying that the recent round of tests came back with a positivity rate of less than 1%. We do not believe the data supports this closure, and we will appeal this decision, Dave Bauer said in an email. This closure may have some short impact on our Canadian customers, but we will work hard to recover as quickly as possible. Amazon said the employees will be paid while in quarantine in accordance to the company policy. So we got an outbreak there, and that's crazy. Here's a video of a doctor that I'd like you to listen to, and then we'll talk after that.
COVID-19 variants are now responsible for 40% of cases across Ontario, and experts are warning about the threat of a third wave. Dr. Peter Uni is the director of the Ontario Science Advisory Table and a professor of medicine and epidemiology at the University of Toronto. Dr. Uni, this new briefing says the province is facing not one but two pandemics. Can you help us understand what that actually means?
Yeah, I think, what is terribly confusing right now is we see wobbly numbers with a curve which is sort of flat if we are just looking at a combination of the early variants and now these new variants of concern. And what we felt would be important is to now unmask this story a bit and just show what's happening with the new variants that are more transmissible as compared with the early variants that we're all now well aware of. It's been a year now that we have been confronted with them. And what we see when looking into that and just try to come up with absolutely realistic numbers, of estimates now, then we see that we keep having the old variants under control. cases are plummeting. That's all good. But the problem is we don't have the new one under control. And therefore, we start to talk about, a pandemic within the pandemic. That's a new one coming, more transmissible, and we just need to be alert once more. It's not long anymore. We're in this race with the vaccines. We can do that, but we just need to be alert now.
A pandemic within a pandemic. So when we show that number that we just had up on our board there, it appears that the UK variant is the one that we should be most concerned with at this point, just because of the numbers alone, Doctor. And we're also hearing it is more deadly. What's your thoughts on the UK variant in particular?
Look, the problem is that most of this deadly nature just comes through the increased transmissibility. So we need to, again, once more, keep the ball really low, keep the curve flat. In addition, that's indeed the case. If you get infected, you have on average, we don't know exactly, but we pinpoint it to roughly 30 to 60% increase in mortality risk. So the numbers that we saw before outside in the community at the same level of infection would need to be multiplied with a factor of 1.3 to 1.6.
Okay, so on one hand, we have a possible third wave coming, and we have field hospitals being built at least one Toronto hospital. Yet the vaccines are coming, Doctor. In fact, the vaccines are here. So how do we balance the two, not getting ahead of ourselves and opening up too quickly or changing our behavior to think that everything is normal?
This is a very tight race now. If we do one more time the right thing, and I'm afraid that's restrictions. I hate them too, but we need to get this first under control with restrictions and then really vaccinate as fast as we can the right people, as wisely as we can, as fast as we can, then we will win this race. But we cannot loosen the restrictions too much. It will probably be the opposite, I'm afraid to say. It's extremely unlikely that we will make it just with the vaccines. We simply don't have enough time. So we need once more firm restrictions, firmer than before, actually. In addition, vaccinate very rapidly, and then we will get this under control. If this works out well with the vaccines, there's one guarantee. If we lock down once more, it will have been the last time that we do that. There won't be any more lockdowns after that. But right now, we're just in a really, just between a rock and a hard place.
Okay. Well,
So you heard what that doctor said. He seems genuinely concerned about the different variants of the virus and being more spread easier. And there is data that indicates that it could be more fatal as well. He says near the end of the video we have a pandemic inside of a pandemic, and I get that, and I don't doubt it, and I'm not questioning that. But why inside of why would we as a country still have our citizens locked down, rights taken away, people being forced in quarantine camps? All these things are happening, costing taxpayers, middle class, more money, more money, more money. Not just us, our kids, our grandkids are going to pay for this. Why would you still push for record numbers of immigration during a time like this? And they want over 400,000 this year, and I believe it's closer to 425,000 next year, in the middle of a pandemic. Here, listen to this video.
Canada will aim to welcome over 1.2 million immigrants between 2021 and 2023. This is by far the most ambitious immigration plan in Canadian history. Beginning in 2021, Canada will aim to target 401,000 new permanent residents. The only time in Canadian history that Canada welcomed over 400,000 immigrants in a year was back in 1913. However, Canada saw its immigration levels fall significantly after that year because of the onset of the First World War. Since then, Canada has never come close to achieving an immigration level this high. In 2022, Canada will further increase its immigration level, and if it achieves the target that it has set of 411,000 immigrants, this will be the highest total in its history. And then by 2023, Canada will aim to welcome 421,000 immigrants.
Well, I see the Liberals who set the bar fairly high with immigration during a pandemic. How does that even make sense?